Concussion Prevention Awareness Resources and Code of Conduct for Parents or Guardians. What is a concussion? A traumatic brain injury that may affect the way you think, feel, and act. It may be caused by a jarring impact to the head, face, neck, or body that transmits a force to the head that caused the brain to move rapidly within the skull, for example, a ball to the head or falling hard onto the floor. It cannot normally be seen on X-rays, standard CT scans, or MRIs, and most people get better quickly, but some have long-term problems with their memory or how they feel, for example, anxiety or depression. It must be diagnosed by a physician or nurse practitioner. Prevention. Be knowledgeable of Halton District School Board's concussion protocol and administrative procedure that outlines prevention, identification, and management of concussions. It is important to educate yourself about the risks of the activity or sport, signs and symptoms of concussions, and the dangers of participating with a concussion. Ensure when student athletes are permitted to bring their own protective equipment that it is properly fitted, properly worn, in good working order, and suitable for personal use. Encourage the ethical value of fair play and respect for coaches, players, and officials. Read and follow the Halton District School Board's Code of Conduct for Parents or Guardians. Promote a safe and comfortable environment for everyone to report injuries. Identification. Everyone can help recognize a potential concussion if they know what to look and listen for. If a student or athlete has a suspected concussion, they may have one or more of the signs or symptoms. They may show up right away or hours and even days later. Just one sign or symptom is enough to suspect a concussion. Most people with a concussion do not lose consciousness. Identification. Hdsb suspected concussion form. Every suspected concussion will require the completion of the Hdsb suspected concussion form. Step 1. Red flags. Call 911. Check for red flag signs and symptoms. Step 2. Other signs and symptoms and quick memory function check. Step 3. Communication to parent or guardian. Step 4. Monitoring or medical exam. Identification. Red flags. Red flags may mean there is a more serious injury. Treat red flags as an emergency and call 911. Identification. Signs and symptoms. Signs are what you observe, such as a blank or vacant look, disorientation or confusion, facial injury after head trauma, balance, slow or labored movements, slow to get up, lying motionless on the playing surface but still conscious. Symptoms are what you hear from a student. Headache or pressure in the head, balance problems, nausea, blurred vision, sensitivity to light and noise, fatigue or low energy, more emotional or irritable, sadness, nervous or anxious, drowsiness, difficulty concentrating or remembering, feeling slowed down or in a fog, and dizziness. Home and school concussion management plan. Parents and guardians will need to follow and support the Halton District School Board's Return to Learn and Return to Physical Activity steps in the home and school management plan for a student with a diagnosed concussion. Return to Learn involves a series of steps to help a student return to their full routine at school. Return to physical activity involves a series of steps that must be followed before a student returns to any physical activity, for example, physical education classes, intramurals or interschool athletics, for example, training, practice, or competition. Students must have medical clearance from a physician or nurse practitioner. Rowan's Law. Rowan's Law was named for Rowan Stringer, a high school rugby player from Ottawa who died in the spring of 2013 from a condition known as second impact syndrome. As a result of her death, Rowan's Law was passed in 2018. This law states that all school boards must have a process in place to review concussion awareness and establish a code of conduct. The last Wednesday of September has been named Rowan's Law Day. Parent or Guardian Concussion Code of Conduct. This is the Hdsb Concussion Code of Conduct for parents or guardians of students under 18 years of age who are participating in board-sponsored interschool sports. As a parent or guardian of an Hdsb student-athlete, I am committed to maintaining a safe learning environment. I will encourage my child to bring potential issues related to the safety of equipment and the facilities to the attention of the coach. I will ensure the protective equipment that we provide is properly fitted as per the manufacturer's guidelines, in good working order, and suitable for personal use. Fair play and respect for all. I will follow the school board's fair play policy and will support it by demonstrating respect for all students, coaches, officials, and spectators. I will encourage my child to demonstrate respect for teammates, opponents, officials, and spectators, and to follow the rules of the sport and practice fair play. I will ensure my child does not participate in practices or games or competitions if they are injured. Learning the rules of a physical activity, including the strict enforcement of consequences for prohibited play that is considered high risk for causing concussions. I will encourage my child to learn and follow the rules of the sport and follow the coach's instructions about prohibited play. I will support the coach's enforcement of consequences during practices and competition regarding prohibited play. I will respect the decisions of officials and the consequences for my child for any prohibited play. Implementing the skills and strategies of an activity in a proper progression. I will encourage my child to follow their coach's instructions about the proper progressions of skills and strategies of the sport. I will encourage my child to ask questions and seek clarity regarding skills and strategies of which they are unsure. Providing opportunities to discuss potential issues relating to concussions. I will encourage my child to participate in discussions or conversations related to concussions, including signs and symptoms, with the coach or responsible adult. I will encourage my child to talk to their coach or responsible adult if they have any concerns about a suspected or diagnosed concussion or about their safety in general. Concussion recognition and reporting. I understand that if my child receives a jarring impact to the head, face, neck, or body that caused the brain to move rapidly within the skull, that they will be removed immediately from the sport. And I am aware that if my child has signs or symptoms of a suspected concussion, they should be taken to a physician or nurse practitioner for a diagnosis as soon as reasonably possible that day, and I will report any results to appropriate school staff. I am aware that not all signs and symptoms emerge immediately, and there are times when signs and symptoms emerge hours or days after the incident, and in these cases, my child must stop all physical activities and be monitored at home and at school for the next 24 hours. If no signs or symptoms emerge after 24 hours, I will inform the appropriate school staff, and I understand my child will be permitted to resume participation. If signs or symptoms emerge, I will have my child assessed by a physician or nurse practitioner as soon as reasonably appropriate that day, and will report the results to the appropriate school staff. I will inform the school principal, coach, and or other relevant school staff when my child experiences signs or symptoms of a concussion, including when the suspected concussion occurs during participation in a sport outside of the school setting. I will inform the school principal, coach, and or other relevant school staff anytime my child is diagnosed with a concussion by a physician or nurse practitioner. I will encourage my child to remove themselves from the sport and report to a coach or responsible adult if they have signs or symptoms of a suspected concussion. I will encourage my child to inform the coach or responsible adult when they suspect a teammate may have sustained a concussion. Acknowledging the importance of communication between the student, parent, school staff, and any sport organization with which the student has registered, I will share with the coach, school staff, and or staff supervisor of all sport organizations with which my child has registered if or when my child has experienced a suspected or diagnosed concussion or general safety issues. Supporting the implementation of a home and school management plan for students with a concussion diagnosis. I understand that if my child has a suspected or diagnosed concussion, they will not return to full participation, including practice or competition, until permitted to do so in accordance with the Hdsb home and school management plan. I will ensure my child receives a medical clearance as required by the home and school management plan prior to returning to full participation in non-contact sports or returning to a practice that includes full contact in contact sports. Prioritizing a student's return to learning as part of the return to school plan. I will follow the recovery stages and learning strategies proposed by the collaborative team for my child as part of the home and school management plan.